everyone, I'm Dr. Amy Miller.
And I'm Dr. Ted Capangi.
And we're the physicians here at St. Louis Skin Solutions. We'd like to welcome you to our exciting virtual event, New You for a New Year. And we're going to talk about the two new treatments we're offering at St. Louis Skin Solutions.
The first option is the Semaglutide Weight Loss Clinic. This is a great way to lose weight in a safe and effective manner. And we're also going to talk about Bioidentical Hormone Replacement Therapy, a new service that we are offering.
We'd like to encourage you to stay for the whole meeting. At the end, we'll have a live question and answer session, so you can submit your questions and we'll answer them live for you.
Our specials include, for the Semaglutide clinic, your first consult and injection for $150, normally $250. And for bioidentical hormone replacement therapy, for your initial consultation and pellet insertion, $450, regularly priced $550.
So, Dr. Capangi, I have to admit, I was a little confused when you came to me and said that you wanted to add a weight loss program to your menu item. Can you tell me why that is?
Well, it's something I got asked about all the time from my bioidentical hormone replacement therapy patients. They struggled with weight, and the hormone replacement therapy was helpful, but we needed to do something more to help them to lose weight. And I'm excited to announce that we can provide an FDA-approved therapy that's proven, that has safety data and decades of experience. And we're using injectable semaglutide.
And what exactly is semaglutide?
Semaglutide is a injection once a week. It mimics a hormone in our gut. It causes you to feel very full. Even after eating a small amount, it decreases your appetite.
Excellent. And it's not addictive like some of the other medicines.
That's right. It really has no addicting qualities to it. The side effects are minimal, but patients do sometimes experience some nausea. Although the nausea is mild, and most of the patients that had nausea continued the drug.
Continue the treatment because they like the results.
They liked the results, and it was mild.
So on average, about how much weight and how long does it take to come off?
Sure. The manufacturer study suggested that after 60 weeks of therapy, that on average people would lose about 15% of their body weight.
Okay.
And that's outstanding for a medication. That's getting close to bariatric surgery.
Wow. What about relapse rates? Do they put it right back on once they come off?
Well, that's a great question because we see that a lot with different diet medications throughout the decades. And semaglutide, you get the weight off and it stays off. And even after you stop the medication, after about 6 months, you will put on some of the weight, but you'll still be about 5% less than your starting weight.
Okay. Absolutely. And what's this about the meal prep plan here?
Yeah, we are excited to partner with a local nutritionist. And it's so important that when you are on a weight loss program that you have a eating plan in place. And this cookbook shows you all different types of meals and how to prepare them and what to shop for in the grocery store.
Absolutely.
A very inclusive cookbook.
Very good. So please join us. Type in any questions that you might have on things that we may not have answered or we're not clear about. We're here to answer questions. Okay, so I know I talked earlier about why I wanted to bring hormone replacement on board and why I thought it was important, but I didn't tell you about my personal experience, and that's what really solidified my desire to bring this on board and share it with patients. Because I've been getting pellets now for about a year, and the difference has just been amazing. I've had so much more energy, I have so much more libido, I can think more clearly, and I sleep so much better. But looking back, all through, as a young female, starting in my late teens, I got put on birth control pills. I had irregular cycles to help regulate my cycles. And I was on birth control pills for a good 20-something years, with breaks for childbearing, of course. But I look back on all that time and all those years that my ovaries were suppressed, and I had no libido whatsoever, and I wasn't building the bone mass that I should have been building. I had no testosterone on board. I finally got off birth control pills and right before menopause, and then went through menopause. And after menopause, I was like, I can't take this anymore. I was having hot flashes. I can't sleep at night. I was waking up. The bed was drenched. It was miserable. So I made the decision to go and get pellets. And it basically solved all those menopause problems, but it's done so much more. Well, first and foremost, my husband prefer that I not talk about this, but my libido has increased 1,000-fold, so we just say it. And I look back on all those years when I was on birth control pill and I had no libido, and I think, wow, this is how sex could have been all along. All these years I missed out, and it really kind of made me mad. But besides that, it's helped with my retention, with my ability to concentrate on things. My sleep is so much better, and hot flashes are gone. I just have more energy. I have more energy now than I did when I was 20-something. So, Dr. Ted, that's my experience. But what can other patients expect?
Well, Dr. Miller, your story is very typical of the majority of my hormone replacement therapy patients. It is a life changer. There are so many things that hormones address, so many different issues. I think first and foremost, hot flushes. Who wants to have to change their sheets in the middle of the night because they've had drenching sweats? And if you have 3 or 4 of those a day, it's debilitating. How can you perform in a business meeting if you're bright red and you feel like you've got to stick your head in a freezer? It just
doesn't work.
It just does not work. So there are so many different symptoms that hormone deficiency causes. Loss of libido, as you talked about. New onset of anxiety and depression, especially if you're older than 40 years of age. New onset insomnia problems. It's very classic that women will not be able to sleep through the night. They'll awaken in the middle of the night and not be able to get back to sleep. Memory loss. Women will complain of fogginess and not being as sharp as they used to be, and not having that recall.
Absolutely.
And then experiencing chronic fatigue. I have a lot of patients that for the very first time that they have fatigue. They've had a lot of energy throughout their whole life, and then they hit 44 and they just have this terrible fatigue. And we see big differences when we treat them with hormone replacement therapy. There's also a lot of body composition issues. My patients tell me about their menopad, and that is their little pot belly that they'll get. When you lack testosterone and estrogen, you tend to put on the abdominal fat tissue. Very classically, dry vagina and lack of lubrication. And who would want to have sex if you weren't lubricated? Also commonly dry eyes and dry skin. There are so many different symptoms that result from a hormone deficiency. And I'm very proud to say that we can treat a lot of them.
And Dr. Ted, this is not just for postmenopausal women. It can be for premenopausal women as well.
That's right, Dr. Miller. So a lot of women will start to experience hormone deficiencies starting in their mid-30s. Commonly, it's a testosterone deficiency that's very subtle. Women will notice a lack of libido, lack of well-being, and over the years, that will then become an estrogen deficiency and a progesterone deficiency. And it's a very subtle changes that occur over like a decade or two. And a lot of women may not notice them or recognize or attribute them to hormone deficiency. So ideally, a woman that has gone through menopausal symptoms or just starting menopause. So the average age of menopause is age 51 in America, but a lot of women will start in their mid 40s. And they will notice hot flushes, and it's a gradual thing, and they'll have a cessation of menses, or they'll stop having their periods for 12 months or more. And that would be the ideal candidate, because at that time the ovaries are shut down and they've gone on vacation, and it makes my job a lot easier when a woman is postmenopausal. But even premenopausal or perimenopausal women can experience symptoms of hormone deficiency, and they can also be helped with restorative treatments, not like a full replacement dose, but like a smaller dose that will help those symptoms.
Absolutely. Well, thank you everyone for spending your Wednesday night with us. I hope you enjoyed it.
And just as a reminder, the specials that we're offering tonight are a obesity medicine consultation, normally retailing at $250. You're going to get it for $150. And that includes the consultation and your first injection of semaglutide. And also the bioidentical hormone replacement therapy. So that would be a consultation and your first pellet insertion. Normally that goes for $550, and tonight we're offering it for $450.
So at the conclusion of tonight's webinar, be sure and check your text messages and reply yes, so we can reach out to you and get a consultation scheduled if you so desire.
And please stick around. We have about 15 to 20 minutes to answer your questions.
Thank you. Good night. Everybody out there in internet land, it's Dr. Amy Miller here with
Dr. Ted Capangi. Welcome.
And we'll answer all your questions you may have about weight loss and bioidentical hormone replacement therapy. So we'll go ahead and we'll dive right in with some questions. Here's the first question is about the semaglutide, and it is involving whether patients gain the weight back. Is it significant that you gain back about 10% of the 15% of weight you lose? Is that true, Dad?
Well, what the studies showed, that the patients that stopped the medication would go on to put some of the weight back on. But my hope is that with my patients that we can institute therapeutic lifestyle changes, and we can make the dietary changes and the exercise changes and have those in place when the time is appropriate to stop the semaglutide. The thing to keep in mind is that obesity is a chronic disease. And that's something that's changed in the last 10 years in general medicine.
Right, absolutely. Okay, next question. question is that my primary care physician is willing to prescribe the semaglutide, but she says it's not available. So how are we able to offer it?
Yeah. So, yeah, Dr. Miller, that is exactly what's happening right now. Semaglutide came out under the brand name of Wegovy, and it just flew off the shelves, and you can't get it into stock. And there's been manufacturing issues with the supply chains. However, the government has allowed compounding pharmacies to compound semaglutide, and that's how we're able to offer it.
And I just have to put a little input in there. At coming right out of training, I had no idea that compounding pharmacies existed, that you could actually create specific formulations for your patients. So I think a lot of docs out there don't even realize that they can get this through a compounding pharmacy. So
yeah, you're not going to find it at your local pharmacy.
Right. Okay. So next question. We're going to shift over to bioidentical hormone replacement. Is there an age limit? The patient says that she's 60 and several years postmenopausal, but would still like to do it. So what say you?
Okay, well, so the literature suggests that if you can do BHRT or hormone replacement therapy within 10 years of menopause, you're in this golden window and you're going to get the most benefit from the hormone replacement and have less risk.
So say you go through menopause at age 50, if you get in there in those first 10 years, that's probably the ideal time.
That's the ideal time.
So after say you're 70, it does the
the benefits decrease a little bit.
Okay.
We always treat our patients as individuals, and there may be very compelling reasons for women to start after that golden window of opportunity. They may have debilitating hot flushes, and so we base it on the individual.
Okay, all right. So really, you got to talk between the doc and the patient.
That's correct.
Gotcha. Okay. All right. Next question. Back to the semaglutide. Is there a big difference in this weight loss program with the semaglutide versus the HCG program, which is human
chorionic growth hormone?
Thank you.
Yes. So yes. So HCG diets have been around a long time. They are very effective for a lot of patients, but you're eating a very calorie restricted diet. And I really think that's why that's worked throughout the years. And then patients that are not able to stick with the 1,000 calories a day are not going to lose very much weight. And the HCG diet has come under a lot of scrutiny and criticism as of late. Semaglutide is different. It is acting as a gut hormone that's naturally found in your gut, and it increases the feeling of satiety and fullness.
So you're not hungry, basically.
Right.
So you don't feel like you want to eat.
Exactly. Yeah. The beauty of it is you're not hungry. You're not thinking about food. You're not obsessing about it. So much of what we do in our day revolves around food. It's just a natural evolutionary drive. And it's such a relief not to have to think about food all the time.
So if I were to get semaglutide injections, then I wouldn't every day be planning what I'm going to eat for lunch. That day I'd be like, oh, it's lunchtime. I guess I better eat.
I better eat, and leftovers are going to be just fine.
Okay. Well, that sounds quite intriguing there, Dr. Banji.
So
okay.
I like to say you eat to survive and not survive to eat.
Yes, ideally, in the ideal situation.
Right.
Yes, indeed. Okay. So next question. I had breast cancer 9 years ago. It was contained and not in my lymph nodes. Yay.
Yay.
And I've been cancer-free since the double mastectomy. Is hormone therapy safe with estrogen-positive receptor breast cancer? That's a great question.
That's a great question, and it's a very common issue. So when we are going to use hormone replacement therapy in women with breast cancer, it's generally after 10 years from the diagnosis of breast cancer, and we have to do it in conjunction with the oncologist. We work together as a team. We need to have the oncologist's blessing before we do that.
So this actually leads me to another question, because when I was doing mine, my doc had me test my estrogen metabolism pathways. So can you tell me more about that?
Yeah, so There are three different types of estrogens in the human body, and they don't all play nice with each other. And what we need to find out is what your estrone levels are compared to your estradiol and to your estriol, the three sisters of estrogen, basically. And it's important that we have a good balance where the estradiol is more predominant than the estrone. The estrone is, or E1, is thought to be implicated with different cancers. And we do look at that during the hormone replacement therapy. I like to get my patients on a stable dose and then check the estrogen metabolism.
Excellent, excellent. Okay. So then you know if you're making more of the estrone versus the other.
Correct. Yes.
Good metabolites.
Yeah,
Okay.
exactly.
Gotcha. Okay. All right. Moving on. How often do you get the pellets implanted? And are there unwanted side effects? That's $1 million question.
Yeah. So, okay. So let me answer that. So generally it's 3 times a year for women, twice a year for men. But it doesn't always have to be like that. It's really depends on the individual. Some women can go longer, some need to go shorter time intervals. And so we individualize it to the patient.
That's interesting because my doc has me coming in every 3 months. Do you think I could switch that out?
Yeah, I mean, you might be able to. There's a thing called pellet burn-off. And women tell me they can feel the pellet levels starting to decrease. And then they kind of know it's time for them to come in. So I let the patient guide us.
Okay. Okay, that's interesting. Okay, very good. Okay. All right. So back to the semaglutide. How often do you need the shots?
Yeah, so the semaglutide injections last about a week. So they're a weekly injection. We do them here in the office. And at that time, we do a weigh-in. We ask you about how your life is going, how stress levels are doing, and what you're eating. It's a way for you to check in and also to be held accountable. Mm-hmm. The behavioral psychologists tell us that if patients are held accountable, they do better in programs.
Well, that's true. That's true. That's when I go work out, I got to go to a class. We have a teacher there watching me. I can't do it at home because I have to be held accountable. It's very true. Okay. So how often do you have to get the HRT? We kind of already answered that.
Right.
Okay. So how much are the recurring injections of semaglutide? So how much does it cost?
Oh, how much does it cost? Okay. Yeah, $90 per injection.
Okay, very good. Okay, so that was a quick answer. Mm-hmm. All right, so moving on. Okay, so on both, is there an age limit?
Oh, okay. So semaglutide's not been studied in pediatrics, although there are doctors using it in that fashion. There isn't really an upper age limit for semaglutide. For the BHRT, women need to have a state of hormonal deficiency, and that's something that we can test for and also ask questions about. So sometimes that could even be in the early 30s. In men, it can happen in their 30s, 40s, and 50s. And then for the upper age limit for BHRT, we individualize that to the patient.
So say a younger woman who just has no sex drive, mm-hmm. Could she do just testosterone pellets?
Well, yeah. So we'd have to do a comprehensive evaluation. Is she taking oral contraceptives? Maybe we could do another form of birth control, maybe an IUD like a Mirena, because the OCPs, the oral contraceptives, naturally suppress a woman's testosterone.
Yeah. I wish I had had this opportunity when I was younger. All right, moving on. Which of the two is better to do first?
It really depends on the individual. Women that are postmenopausal, they'll have what we call the menopad, and getting onto the BHRT can help shrink that intra-abdominal adiposity or the stomach fat. And so that may make sense to get started on that to address the underlying issue instead of just restricting calories.
In my personal experience, I think getting my hormones straightened out really helped with the weight issue. So
you're going to be able to exercise more. You're going to be more energetic.
Exactly.
You're going to be more motivated, less mental fogginess. It's kind of like a new lease on life for a lot of women.
Right.
That's what I've seen.
Yeah, exactly. I was more motivated to go exercise, and I was happier to do it. Okay. How often do we need to get the pellets? Weekly shots for weight loss, but once again, how often?
Generally 3 times a year for women, men twice a year.
Okay. So next question. This is a really good one. Can increased testosterone cause hair loss?
Certainly. And so there are metabolites, or testosterone gets broken down in the body to different metabolites that can cause baldness. And that's something that we need to monitor and watch, and also check the metabolism of the testosterone that we're giving in a testosterone pellet.
I think the thing that happens most often is there's extra body hair growth.
Right. And that's going to be more likely an issue. And it's
which we can laser off with our laser hair removals.
Right, or even electrolysis.
Right. So that's not an issue. Really.
I mean, I kind of use the story about, you're going to get to move into this beautiful mansion, Dr. Miller, but you're going to have to mow the grass a little bit or pull some weeds.
Okay, I'll do that. Yeah, that's not a big deal.
So most women are very happy. They're just feeling so much better that a couple of facial hairs here and there is not a big deal. And it doesn't necessarily mean that you're going to get facial hair, but it does happen sometimes.
But on the flip side of that, androgenic alopecia is a huge concern, especially for women, because there's not a lot of great medical treatments for it. So I can see why that would be a concern. Though, once again, here at Signal Skin Solutions, we do microneedling with PRP, which has been found to be very helpful with hair growth. So if you guys have any questions about that, that's for a later date. We can talk about that later. But don't put off bioidentical hormone replacement therapy because you're worried about hair loss.
Yeah, there's just so many benefits with the BHRT for the skin. I mean, the skin, the collagen levels increase, just a lot more full. You can really tell a woman that's on BHRT, that's postmenopausal, compared to someone who isn't taking it.
Right, and that's why I feel like it's so important, because I've seen the difference in my patients. But the other thing, not just the skin, the bones, the brain, I mean, the gut, the lungs even have hormone receptors.
There are estrogen receptors throughout the whole body. It seems like every week they're discovering new locations for receptors and the positive effects that the estrogen has.
Yeah, exactly. Okay, so next question. How long do you have to have the injections for the weight loss?
Okay, so again, it's something that we individualize, and there isn't a set arbitrary time or length that you need to be in the program. If it's working for you, we can continue it. We do know that obesity is a chronic disease. So there isn't a reason to suddenly stop the medication, as there are with some other medications like phentermine. You have to stop the medication after a certain amount of time, and then also the phentermine stops working too.
Okay, so does the semaglutide, does this slow down your metabolism in the long run? And then when off the pellets, do you want to eat more again?
She's confused. She's got a mix.
But do you have lower metabolism?
Okay. So we don't think that semaglutide slows down the metabolism. It does slow down the transit time, or the speed that food moves through your stomach. And therefore you eat a little bit and it's kind of sitting there like Thanksgiving dinner, and you feel very full and you're not likely to eat any more.
That's nice. Okay, so let's see. Moving on. Can you do this if you have an IUD?
Yes.
Yeah.
Mm-hmm,
okay.
Definitely.
Okay. All right. Well, that was an easy answer. Okay. All right. For a man getting the testosterone, is that a pellet or injection?
Yeah. So I allow the men to decide if they want to do injections or pellets. Injections, they usually end up being weekly. and some men are fine with that. That there can be a lot of up and down, and it gets kind of frustrating. Whereas for men, the pellets are kind of a set it and forget it, and you're good for like 6 months, and you don't have to think about it. You don't have to worry about injections. You don't have to worry about putting gels on yourself. So I think that's kind of the Cadillac approach.
So when I was first learning about hormones, they were talking about the different types of testosterone injections, and some are better than others. Can you tell me? Can you elaborate on that some more?
Well, so in reality, we use 2 injectable testosterones nowadays. They're fairly equal in duration. But what you'd never want to do is take an oral testosterone.
Okay.
However, there is a new one that's come out. It's still too early to say if it's how effective it is, but it's thought to be safer. But generally, oral testosterone is going to adversely affect the liver.
And I was taught too that oral testosterone will be excess will be metabolized to estrogen. Is that true?
Well, so any testosterone, especially for men, can be changed to estrogen or broken down to estrogen. It's called aromatization.
Right.
And sometimes when men will notice some tenderness in the breast, and then on occasion we do have to use an aromatase inhibitor medication to help prevent that.
And is that a pill or is that
that's a pill, and we can dose it sometimes like twice a week.
Okay.
But we have to be careful with that because men need a little bit of estrogen too. They need it for their bones.
Right. See? Yeah. Okay. Okay. So, how is the pellet specific to each individual, and is it FDA approved?
So the pellets are compounded in compounding pharmacies, and then the FDA and the pharmacy boards have regulatory oversight of these pharmacies that compound them. And so how's the pellet specific to each individual? Well, we start off with a general dosing guideline, but then we have to tailor the therapy to the individual. Some women will metabolize it faster than other women. Women that are thinner may need higher doses of the estrogen. And when a man or woman has a lot of fat, that fat can kind of harbor the estrogen or produce the estrogen itself.
Gotcha. Okay.
So they may need a lower dose initially, but then sometimes what happens is then the fat goes away, the menopad goes away, and then they need a higher dose. So we are watching all our clients. We do blood work on a very routine basis to make sure that we're having the effect that we want and that we're getting the levels to a safe level.
Okay. All right. Next question. Is it a local anesthetic for the pellet, and is there any downtime with that?
Okay. Yeah. Great question. So yes, we are using a local anesthetic. It numbs up the area. And the downtime, so women are usually asked to not do strenuous exercises using the legs for about 2 to 3 days. Now, men are much more difficult. They have much higher needs for the testosterone. They get about 9 pellets, and so they take about 5 to 7 days of activity restriction. So no doing squats. Yeah. So you don't want to extrude the pellets.
Right. So no glute workout.
Yeah, you try to.
They could do upper body and abs, but no glutes kind of things. Okay, gotcha. Okay. And then how much is the consultation for the testosterone pellets and the pellet placement?
Okay, so the bioidentical hormone replacement consultation, that is a consultation, in-depth consultation with me, and then also the first insertion, and that is $550, and that will also get you what we call a boost dose. So commonly, when a woman has never been on hormone replacement therapy and is new, after about 5 weeks from their first initial insertion, they need a little bit of a boost dose to keep the levels high or into the appropriate range. When a woman's body's been starved of estrogen, you introduce estrogen and it just soaks up all the estrogen and puts it in the estrogen bank account. And the levels can start to dip at about week 5. And that's just only with the very first insertion.
Okay.
So that 550 covers the initial insertion, the boost dose, and then the consultation. And then going forward, it's $375
Okay.
per insertion.
So tonight, because they watched tonight, there's a special. What is that again?
It's 300 and
Sorry. Go ahead.
it's $450.
Okay. All right. Next question. This is a great question. What compounding pharmacies do we use?
Sure. So currently we're using Compounding Pharmacy of America, located in Knoxville, Tennessee. And we're also going to bring on Belmar Pharmacy out of Colorado.
And then for my derm patients, for my skincare patients, we use a local pharmacy for the topical compounded, and that's Genesis Pharmacy. Okay.
Yeah,
so,
I want you guys to realize that, there is a preference for pellets, but pellets may not be right for everyone. And there is definitely a place for creams and topicals and sublingual troches.
Well, what's nice about that is that you can monitor it day to day.
Well, there are some benefits, but what we find is that you do the sublingual troche underneath the tongue, and the levels spike up, and then they come down. So, and then you're spending a lot of your day in either too high or too low, and not where you need to be in the middle.
So the pellet is more of a stable.
Yeah, it's a nice, stable level.
So my question, once you get the pellets, how long is it till it's in the bloodstream and having an effect?
Yeah, so women report to me after a couple of weeks, you'll start noticing some changes.
Okay, so the first week or two, you may not notice a whole lot,
right.
But okay. All right. Do you require labs before the semaglutide injections?
Oh, okay. With semaglutide, it all kind of depends. Lots of times patients are being followed by their primary care doctor, and they've had labs done within the last 6 to 12 months. I like to see if they are pre-diabetic. I like to see if their liver function is okay. So most of the time those labs are already being done, but we can order them. I certainly can order them and check them as needed.
Okay. All right. Next question. Does getting massages after either of these affect the outcome?
Sure. So we ask that women avoid getting massages to the buttocks. The pellets are placed in the buttocks. And then the semaglutide injection is in the abdominal wall. Not really a common place that you're going to get a massage.
Okay. Now, next question. So since men are a little simpler than women, women have a little more to look at with the progesterone and the estrogen and the testosterone. Men, as often it's just the testosterone. So once again, men, just, I hate to say it, men are simpler than women. No offense, anyone out there. But for a man, is it the same price as for a female?
So actually, it's not. It's more expensive, and and that's because it's technically a much more difficult procedure.
Gotcha.
It's like doing a woman's insertion times 3.
Oh.
And so we have to make 3 different channels to implant the pellets.
Okay. So does it cost more?
Yes, it is, because they require many more pellets.
So what is the cost?
So that is $850.
Okay. All right.
And that's usually twice a year, though. So men get by with only coming in twice a year.
So really, it works out over time to be about the same.
Yeah.
If I'm doing the math in my head correctly. Okay. All right. Which I'm not great at. All right. So, and then just another question to confirm: the initial consult is for $50, and then follow up and implanting future pellets is that $395 per session? Is that right?
$375 per insertion.
Okay, so for tonight, $450 for the initial, and then $375 every 3 to 5 months, depending on the patient.
That is correct.
Okay, all right. Okay, well, it looks like it's about time to wrap up. I'm getting the sign from the director here, so Thank you so much for joining us. And please, if you have other questions or anything you want to ask, you can call us. You can set up a consultation so we can get really specific and get down deep in the weeds with you about your specific questions. But thank you so much for joining us.
And it's been a pleasure. I'm excited to be here, and I look forward to meeting you guys.
Thanks. Good night.
Good night.